Hey everyone, let's jump right into this explainer and unpack exactly what the 2026 Aetna Medicare Value Plus HMO plan has to offer for your healthcare journey. I know, navigating Medicare options can sometimes feel like trying to learn a completely new language. But today, we're going to break down the actual source documents and make it incredibly clear. Whether you're just reviewing your current coverage or scoping out this plan for the very first time, we're going to dive into the exact numbers, the rules, and the benefits you really need to know, focusing on everything from your medical and prescription coverage all the way to dental, vision, and hearing. So the burning question on your mind is probably this. What kind of value are you actually getting for a $36.40 monthly premium? In the world of Medicare Advantage, low upfront premiums are pretty common, but the real story? Well, that's always buried in the fine print. We're going to pull apart this entire benefits package, from everyday medical care and prescription drug inclusion to those specialty perks like dental, vision, and hearing, to see exactly how far your premium dollars are going to go. Here's our quick roadmap for today. 1. Plan basics and eligibility. 2. Costs and out-of-pocket limits. 3. Medical and emergency coverage. 4. Diagnostics, labs, and imaging. 5. Hearing and dental benefits. And 6. Over-the-counter extra perks. All right, kicking things off with Section 1, Plan Basics and Eligibility. Now, this plan puts a really interesting spin on your traditional HMO model. Yes, you do still need to pick a primary care provider to, quarterback your overall health, but here's the kicker. You actually have the freedom to see specialists without needing a formal plan referral first. Obviously, a specialist might personally ask for a recommendation from your doctor, but Aetna itself isn't putting up that referral roadblock. It's also worth noting right off the bat that this is a Medicare Advantage plan that includes prescription drug coverage, so it bundles your medical and pharmacy needs right together in one package. To get in on this, you've got to have Medicare Parts A and B, and this is absolutely crucial, you need to live in one of the eligible counties across Kansas and Missouri. We're looking at 36 counties in Kansas, places like Douglas, Johnson, Riley, and Shawnee. And in Missouri, it covers 17 counties, including Jackson, Clay, and Platte. Remember, location is literally everything with Medicare Advantage. If your primary residence isn't in one of these specific spots, this plan just won't be an option for you. Moving right along to Section 2, Costs and Out-of-Pocket Limits. So your monthly plan premium sits exactly at $36.40. Keep in mind, you do pay this on top of your standard Medicare Part B premium. It is an extra layer of cost, sure, but as we're about to see, it unlocks a whole specific suite of benefits and cost caps that original Medicare on its own simply doesn't offer. And here is a massive win, a $0 plan deductible. That literally means your coverage starts working for you from $1. There's no frustrating waiting period where you have to shell out thousands of your own money before the plan finally steps in to help with those medical costs. Okay, before I show you the next number, let's talk about MOP. That stands for Maximum Out-of-Pocket, and it's essentially your financial safety net. Basically, once your copays and coinsurance hit this specific dollar amount, you pay absolutely nothing for covered medical services for the rest of the calendar year. Just remember, though, your premium and your prescription drug costs do not count toward this limit. For 2026, that maximum out-of-pocket limit is locked in at $4,900. This is what protects your life savings from catastrophic medical bills. Even if you faced a severe illness or needed extensive surgeries, situations where bills can just skyrocket, your liability is capped at that $4,900 mark. After that, Aetna picks up 100% of the tab for covered medical services. Next up, Section 3, Medical and Emergency Coverage. Under this medical umbrella, you get to enjoy a $0 copay for preventative care. We're talking your annual wellness visits and baseline screenings designed to keep you in top shape. But, and this is important, you really need to remember that hospital stays and certain specific services require something called prior authorization. In plain English, your doctor has to get the green light from Aetna before you get those services, or else the plan might not cover them. Now, if you're a traveler, you're going to love this direct comparison. Stateside, urgent care is super accessible at just a $25 copay, and an emergency room visit inside the US will run you $130. But what if you're overseas? Well, you're actually protected with worldwide emergency and urgent care coverage. Internationally, you're looking at a $130 copay for either emergency or urgent care, plus $260 if you need an ambulance. And the plan caps this worldwide protection at a whopping $250,000. Talk about serious peace of mind. Let's dive into Section 4, Diagnostics, Labs, and Imaging. This plan definitely operates on a no surprises rule. Basic lab services and outpatient x-rays, those cost you $0. Interestingly enough, this $0 tier also covers some specific diagnostic tests, things like the retinal fundus exam for your vision, spirometry for your lungs, and peripheral arterial disease testing. Quick side note here, while you do get that $0 retinal exam, the plan's overall vision coverage is honestly pretty light compared to its dental and hearing perks. Now, as tests get more complex, your costs do go up. Standard diagnostic tests have a $25 copay, and advanced imaging, like CT scans and MRIs, will run you $170. And again, don't forget that prior authorization might be needed for those advanced scans.
All right, on to Section 5, hearing and dental benefits.
Starting with hearing, you get a $0 routine annual exam through the nation's hearing network. This is your basic yearly checkup to monitor your hearing health. But if a specific medical issue pops up with your ears that requires a deeper look, you're looking at a $25 copay for a diagnostic hearing exam. But here's where it gets really good. The plan throws in a $1,250 annual allowance per ear to purchase hearing aids. You just have to use a provider within that nation's hearing network to tap into those funds. If your chosen hearing aids cost more than that allowance, you just pay the difference. Still, having up to $2,500 in total assistance every single year is a massive benefit. Switching gears to dental, you pay absolutely nothing out of pocket for preventive services. That means your oral exams, standard cleanings, and routine dental x-rays carry a $0 copay. Getting your teeth cleaned twice a year won't cost you a single dime. And even better, these preventive costs do not eat into your overall annual dental allowance. Now, if you end up needing more comprehensive work, think fillings, extractions, or crowns, you have a solid $3,000 annual allowance to help offset those costs. You do need to be aware, though, that you'll be responsible for a 20 to 50% coinsurance on these major services, depending on exactly what you're having done. But the plan will chip in up to that $3,000 limit before you have to pay the rest.
Finally, we've reached Section 6, over-the-counter extra perks.
As a member, you'll get the Aetna Medicare Extra Benefits card. This thing basically acts like a special wallet to help you easily manage your over-the-counter spending. It looks and works just like a regular debit or gift card, making it super seamless to use right at the pharmacy counter. Here's the breakdown. Every 3 months, $75 gets loaded right onto this card for you to buy essential health products. We're talking pain relievers, first aid supplies, allergy meds, all those approved wellness items. You can swipe it in store at participating CVS retail locations, or just order your stuff online or by phone through CVS OTC Health Solutions. It is basically $300 a year in free drugstore staples. So, as we wrap up, you've got to ask yourself, does this specific mix of fixed low costs and high-value specialty perks actually align with your personal healthcare strategy for the coming year? We've walked through the solid $0 deductible, that incredible worldwide emergency coverage, and the really substantial allowances for dental and hearing. But we also can't ignore the $36.40 premium and those prior authorization rules. Does this setup give you the peace of mind and the everyday value you're actually looking for? Take a really close look at your expected medical needs and let these numbers guide your decision. Thanks so much for joining me on this explainer, and remember, keep asking questions and keep learning.